Hello everyone, my name is Li Su. The topic I'm presenting today is Type 1 diabetes. Type 1 diabetes accounts for about 5 to 10% of all diabetes cases, which means it has a population of 21.1 to 42.2 million patients around the globe in 2014. It is a widespread chronic disorder, and it has two forms of causes. One form is cell-mediated autoimmune attack on beta cell. Another form is insulin deficiency. Diabetes occurs more often in low-income and middle-income countries than in high-income countries. It has 5 to 10 times greater prevalence rate in Oceania, Middle East, and North Africa than in some of the developed European countries. Type 1 diabetes occurs earlier in life than type 2 diabetes. It has higher incidence rates throughout childhood or early adulthood, and the disease can be inherited through HLA complex. Type 1 diabetes may cause several complications including cardiovascular disease, hypertension, depression, eating disorder, and genetic predisposition of offspring. There are two strategies of type 1 diabetes treatment. As we all know that type 1 diabetes occurs earlier in life, strategy 1 is to increase government funding for school on improving the quality of life for kids and teenagers with type 1 diabetes. Because students with type 1 diabetes need additional medical care including healthy diet, medicine, and nurses to monitor glucose level and administer insulin. According to National Conferences of State Legislature, not all states enforce health insurance coverage for diabetes patients. Strategy 2 is to make sure all type 1 diabetes patients are covered with health insurance so they can receive consultation from doctors and be able to afford medicine. Section 504 of the Rehabilitation Act of 1973 ensures that all schools that receive federal funds, including public and private schools, must accommodate the needs of students with diabetes, so staff members are trained to monitor glucose level and are capable to respond to medical emergency. Students are permitted to fully participate in all school activities like normal students and are allowed for extra day off for doctor's visit. Affordable Care Act was passed in 2010, and it makes sure that health insurance companies won't deny coverage or charge more for treatment for pre-diagnosed diabetes patients. As type 1 diabetes requires long-term medical care, health insurance coverage reduces the financial burden of patients. Researchers believe that it is possible to delay or prevent type 1 diabetes based on our current understanding of immunopathogenesis of type 1 diabetes, but the current study results are ambiguous on the prevention or delayed effectiveness of type 1 diabetes, and further clinical trials are needed to determine the benefit of the prevention method. Patients with type 1 diabetes also have huge financial burden, including lifetime medical costs of an estimated of $110,000 per patient, and therefore, health insurance is essential in covering part of the medical cost. My opinions on this public health problem is that type 1 diabetes occurs in early life and cannot be completely prevented or cured, which cause patients inconvenience in daily life and lifetime financial burden. Although more research studies are underway to try to find treatment and prevention methods, they are not enough compared to our involvement in other chronic disease studies. Our society still needs to pay more attention in improving the living standard of existing patients and try to make type 1 diabetes patients live a normal life like us before we found the cure. That's all for my presentation today. Thank you.